Healthcare in Ukraine is under attack. Since the onset of Russia's full-scale invasion in 2022, Ukraine's healthcare workers and facilities have been attacked more than 1,000 times. Targeting healthcare is part of Russia's wider attempt to enforce its control over Ukraine's civilian population. In Russian-occupied territories of Ukraine, attacks on hospitals, clinics, and ambulances prevent civilians from accessing healthcare and put healthcare professionals in harm's way. Evidence shows that Russian forces may have been using Ukraine's hospitals for non-medical purposes, including as military bases, which violates their protected status under international law and further limits access to healthcare for the civilian population. The head of the Hostomel Primary Care Center was there when Russian forces occupied her clinic.
In the building of this primary clinic was the base of the Russian military, and in the basement of this building were children, civilians, who were not even allowed to go outside.
Healthcare workers in Russian-occupied territories are reportedly being harassed, attacked, detained, and sometimes tortured.
Russian soldiers came to our home. During the interrogation, they asked me what I do, and I said that I am a doctor and that I have been working only in healthcare for more than 20 years. And after the interrogation, they put us in the corridor, put bags on our heads, tied our hands with tape, and started twisting and strangling us with tape around our necks.
Anna, a combat medic, was also detained.
Чесно, це була гра на виживання. Я зараз кажу не про поодинокі випадки фізичного, сексуального насилля або тортур. Я кажу про систематичне, грубе порушення прав людей і прав як військових, так і цивільних.
Attacking healthcare workers is not only a violation of international law, endangering their lives and well-being, but also has a profound ripple effect on Ukraine's population. There have also been reported incidents of forcible changes of nationality, often called passportization. This policy may prevent Ukrainian citizens in occupied territories from accessing healthcare unless they acquire Russian passports, effectively forcing them to assume Russian nationality. Clinicians who refuse to obtain a Russian passport or who treat patients that refuse passportization may also face sanctions or reprisals. Everyone has the human right to access healthcare. Attacks on healthcare are violations of international law and must not be allowed to continue with impunity. Russia must immediately cease its aggression and stop all attacks on healthcare in Ukraine. These attacks must be investigated and the perpetrators brought to justice.